Good day everyone. So we are the last group to report the module 13. So our topic is all about horse health, disease prevention, and parasite control. I am Lididen Mamaril. For our target outcomes, at the end of this chapter, the students should be able to understand and evaluate horse health, discuss the importance of vaccination and parasite control in the horses, enumerate and discuss the basic health care for horses, and discuss the importance of exercise in horses. For the topic to be discussed, first one is the horse health, vaccination, parasite control, dental care, hoof care, colic and laminitis, and exercise. Horse health. To keep your horse healthy, it is important to vaccinate it against certain diseases, deworm it regularly, and properly care for the teeth and feet. Horses are also susceptible to conditions such as colic and laminitis, which can greatly diminish the horse's usefulness or even end in death. The purpose of this chapter is to give you an overview of health issues facing horse owners. The best advice is to establish a regular healthcare program with a local veterinarian who has interest and expertise with horses. Let the veterinarian help you make healthcare decisions. It is also important to find a farrier who you are comfortable working with and who can help you make decisions regarding the care and maintenance of your horse hooves. We all know that horse is a majestic animal, right? And part of being a responsible owner is to provide them with quality care and attention. While it can seem time-consuming, spending time with your horse and keeping an eye on their general health will not only make their life a long and happy one, it will also reduce veterinary bills. Okay, let's talk about common health problems in horses. First one is the back problems. Back problems aren't much of a surprise when it comes to horse and ponies. Usually, they may develop when a horse falls or rolls and happens to pull a muscle or ligament. Sometimes, a horse can have back problems due to ill-fitting saddles. So, for example, if the saddle doesn't fit well, the rider may end up hurting the horse or lose their balance, which can induce equine thoracolumbar pain, or in other words is arthritis, which is the spine can become tender and painful over time. So, for an accurate diagnosis, they can proceed to do an X-ray examination or ultrasounds if necessary. So, lastly, the combined effort of a farrier and the vet can treat the back problem. However, if the problem persists, a professional saddle fitter may be involved later. Second is arthritis. So, di lang pala tao nakaramdam nito, pati yung horse natin. So, arthritis or osteoarthritis, more commonly known as degenerative joint diseases. So, significantly affects horse range of motion. The horse may start acting stiff because the affected joints swell over time, appearing much larger than usual. Arthritis is precisely one of the common reasons most horse owners feel the need to retire their horses. So, as unfortunate as this may sound, once your horse has arthritis, there is no cure for it. To avoid the possibility of horse suffering from arthritis, it is better to start taking measures early on. Next is inflammatory bowel disease. So, inflammatory bowel disease, or most commonly known as IBD, is a group of internal diseases that cause the digestive system to falter. So, the spectrum of IBD diseases affect the stomach and intestine and can also affect the skin, respiratory tract, and internal organs. The primary symptoms are chronic weight loss, lack of appetite, diarrhea, or fever. Common cold. So, during the early stages of developing a common cold, most horses have one clinical sign, fever. If the fever is high enough, so yung horse natin is nakaka-experience sila ng dehydration, anorexia, or inappetite. So, there's nothing much to worry about truth. So, because of most of the time, the fever is so short-lived that it passes by unnoticed. So, once we identify the common cold symptoms in our horses, so we should call vet and isolate horse as this disease spread quickly with a group. Equine herpes virus, or called it EHV, is the primary reason for the respiratory and neurological problems and abortions. Symptoms usually include nasal discharge, loss of appetite, cold, and fever. Vaccinations are available to fight against the virus and prevent the further spread of the disease. So, but it is recommended that healthy horses get vaccinated before they get sick. So, if you suspect that your horse may develop EHV already, we should separate them from all the other horses to prevent spreading of EH virus. Ringworm is caused by fungus that can spread quickly from one horse to another. Initially, the infection can be seen in tufts of hair that fall off and leave lesions. To avoid ringworms, hygiene should be number one priority, and also try and use different tacks for each horse. Last common health problem in horses, which is the mud fever. Mud fever is associated with humid and muddy condition where the infection is inflicted by something that survives in the mud. So once the horse is infected, it can develop a fever and later have stomach issues where the stomach becomes inflamed and scaly. Properly washing the legs and drying them is one of the ways we can prevent a horse from developing mud fever. If we notice an infection in our horse, so keeping it clean is imperative. Under the care of a vet, further treatment can be observed to help our horse recover for this mud fever. To achieve our horse health and disease prevention and parasite control, here are the listings we should do. Feed. Horses must have access to an adequate amount of good quality feed in the form of rosage, pasture, hay, or chaff to keep them in good body condition. A guide to the amounts to feed is 1 to 2 kg per 100 kg of body weight. You may need to supplementary feed a horse that is being worked regularly, or if there is not enough pasture and the horse is losing body condition. Provide a salt lick or mineral block in paddock. Water. Clean water must always be available. A dam or self-filling trough is best. Bathtubs, if used, must be checked daily and refilled if necessary. Dams and self-filling trough should always be checked frequently. Buckets are not suitable as a permanent water supply as they can be tipped over. As a guide, a horse may drink 25 to 45 liters per day in a hot weather. Shelter. Horses need shelter from extremes of sun, wind, and rain. Trees or a walk-in shed stable makes suitable shelter. A waterproof rug can be used to protect the horse from cold weather but must be checked daily to ensure it is not rubbing, slipping, or leaking. Paddocks. Fences must be kept in good repair to prevent injury and escape. Remove rubbish and weeds regularly to prevent injury to the horse. Be aware to prevent threats such as loose wire or attractions such as neighboring horses that can cause a horse to be injured by a fence. Feet. Have a farrier trim the hooves every 6 to 8 weeks to prevent them chipping or becoming too long and uncomfortable for the horse. Shoes are only needed if the horse is to be ridden on hard or rocky ground. And the last is teeth. Teeth need to be checked by a veterinary dentist at least once a year for a horse kept in paddock. If not treated, they can become sharp and cause pain and mouth injuries. Horses under the age of 5 or those feed grain need a dental check at least once every 3 to 6 months. Again, to keep our horse healthy, it is important to vaccinate it against certain diseases, deworm it regularly, and properly care for their teeth and feet.
Buenos días, profesor and compañero de clase. Monjan Charlotte C. Vidal, and I will be reporting about the vaccinations and parasite control. Vaccinations. All horses should be vaccinated annually against tetanus, eastern and western encephalomyelitis, and rhinopneumonitis. Depending on your location, the number of horses on your facility, the age of the horses, and the exposure to the horses, it may be advisable to vaccine for additional diseases. If your horse wound himself, especially a puncture wound, it is suggested that the horse receives tetanus antitoxin. Even if it was vaccinated for tetanus earlier in the year, talk to your veterinarian to design a vaccination program that is most appropriate for your situation. And before you buy a horse, have a Coggins test performed to be sure it is not carrier of equine infectious anemia. There is no vaccine or cure for this viral disease. So many shows, sales, and farms require a negative test to participate in their activities. If you are planning to transport the horse across the state's line, state's transportation laws requires that you have a Coggins test performed. The horse must test negative. It is important to take the paperwork with you on the trip, as you may be asked to show evidence that the horse has been tested negative. And for the control of flies, mosquitoes, opossums, and birds is a big part of minimizing disease. They are the carriers of disease-causing organisms. Proper manure disposal, proper composting, removal of standing water, and keeping the area sanitized help reduce infestation and spread of disease. In parasite control, horses are susceptible to internal parasite infestation. Parasites can be controlled through regular deworming programs and proper waste and pasture management. Some indications of parasite infestation are weight loss, rough hair coat, loss of appetite, listlessness, tail rubbing, and colic. The most prevalent parasites are strong lice or bloodworms, ascarids or roundworms, bats, and pinworms. It is recommended that your horse be dewormed 4 to 6 times per year. The frequency of deworming needed varies based on herd size and stocking rate, or the number of animals acre, as well as the age of the animals. For example, a larger number of horses in a small pasture need to be dewormed more frequently than a small number of horses in a large area. It is also recommended that the young horses be dewormed on a more frequent schedule. Consult with your veterinarian to develop a deworming program that is best suited to your situation. And we have the most common method of deworming. First, we have the feed additives. If the additive is the daily feed, it will need to be boosted with the bolus deworming treatment periodically. Second, we have the oral tubes of paste. Most deworming medications are now available in easy-to-use tubes. Third, stomach tubes. This method involves passing a tube through the horse's nose and into its stomach, so should only be performed by veterinarian. And when we develop a deworming program, it is necessary to rotate the type of anthelmintic or deworming medication used because parasites can develop a tolerance to compounds over time and eventually become resistant. External parasites such as lice, ticks, grubs, and ringworm are seldom a problem if the horse is kept clean and groomed regularly. And if external parasites to become a problem, contact your veterinarian for recommendation on treatment. Thank you.
Dental care. The horse chews its food in a grinding fashion, and thus evenly wears off the surface of the molars. In some situations, the horse does not evenly wear its molars, and points can form, making eating painful because these points irritate the tongue and cheeks. Therefore, the horse chews less and feed is utilized less efficiently. When points occur, they need to be floated or filled off, and then the horse will eat comfortably again. Indication of sharp points on the molars are weight loss, whole kernels of grain in the manure, and slobbering while eating. Some horses are developed wolf teeth on the top jaw just in front of the first molar. These two teeth are not rooted and can be easily removed by a veterinarian or equine dentist if they cause discomfort. Problems with wolf teeth are usually noted when the horse is ridden with a bit, which can bump against the teeth and cause discomfort. Although uncommon, horses can also develop abscesses, impact teeth, or a variety of other dental problems. Teeth should be checked at least once a year for the presence of any of these problems. It is especially important to check the teeth of older horses regularly, as they are more likely to have dental problems requiring the attention of a veterinarian skilled in equine dentistry or an equine dentist.
Colic and laminitis are the two of the most devastating diseases facing horses, and good management can reduce the incidence of either disease. Colic and laminitis are the two of the most common equine ailments, can both result from overconsumption of high carbohydrate concentrates of lost grass. Impaction colic, blockage of the intestinal tract preventing normal movement of digestion. Impaction colic is an accumulation of feed or other dry and digestible material that obstruct the horse colon. Impaction colic is caused by obstruction in bowel, typically in areas where the large intestine changes in direction or diameter. Gas colic, a buildup of gas in gastrointestinal tract. Gas colic develops when a horse ingests forage that is in high sugar, usually lush spring grass, and excessive fermentation occurs in the gut, which creates a buildup of gas. And the last one is twisted colic. A part of the gastrointestinal tract becomes twisted, causing pain, potentially permanently damaging or killing part of the gastrointestinal tract. Torsion or twisting of the large colon is one of the most painful and serious forms of colic in horses.
Good morning, everyone. My name is Odyssey Gray, and our topic for today is the exercise for the horse. So, exercise for the horse takes various forms: riding, driving, lunging, and turning out the animal are all satisfactory methods. If your horse is kept outdoors, it will exercise to some degree by walking around. However, if your horse is stalled, it should get out for at least 60 minutes each day. And this can benefit your horse, lalo na po sa cutting calories, which weight loss as a result of reducing calorie intake had a number of benefits. Regardless of whether or not the horses and ponies did any exercise. So, pwede pong ma-benefit nito yung reduced body weight, body condition score, total body fat, and crusty neck score. Increase adiponectin, a hormone produced by fat cells. Low levels of adenectin are a risk factor for laminitis. Decrease baseline insulin. High levels of insulin in the blood have been linked to an increased risk of laminitis. Decreased leptin, a hormone produced by a fat cell which helps to regulate appetite, fat storage, and calorie burning. High levels of leptin are typically associated with obesity. Although exercise did not increase weight loss, it did produce additional benefits that were not seen in the restricted diet only group. The main one being improved insulin sensitivity. More insulin sensitivity horses and ponies need to produce less insulin in order to control their blood sugar. This is important because high levels of insulin in the blood and or reduced insulin sensitivity are risk factors for laminitis. Horses and ponies in the exercise group also had decreased levels of serum amyloid protein, which is a marker for inflammation. Never allow your horse to eat a meal or drink unlimited water immediately after exercising because it can cause colic or founder. The most effective way to cool the horse out is to remove the tack, hose the horse down to remove sweat and dirt, and walk the horse at its own pace, allowing it to take a few sips of water periodically. So yung colic or founder, ito yung severe, often fluctuating pain in the abdomen caused by intestinal gas or obstruction in the intestines and suffered especially by babies. So mas delikado pala to kapag sa mga bata pa lang na horse. Grooming or hosing down the horse after exercise will remove sweat and dirt and provide an opportunity for you to examine the horse and make sure it didn't receive any injuries during the exercise period. Putting the horse away clean will also reduce itching and irritation to its skin and improve hair coat quality. So para din sa ating mga tao na syempre after a good workout or exercise, kailangan natin magkaroon ng proper hygiene para hindi mangamoy yung pawis natin and magkaroon tayo ng body odor. So ganun rin po sa horses at marami pong benefits sa horse na syempre maiwasan po yung itching, irritation sa skin, tapos lalo na po yung pinagusto natin na makintab po yung coat ng kabayo. Yun lang po. And thank you for listening.